We're speaking as if there weren't separate insurance commissioners and state regulation before the ACA and during the ACA. So there's going to be state differences on how this happens because the regulation is a very localized issue. You can speak to that more than I can, right? And so this whole, I mean, like this whole thing about selling across state lines, okay, whatever. It's you regulate in state lines, so it really doesn't matter what else you talk about on the federal level. It's how do you actually figure out in Durango, which is in the southwest corner of my state, the closest thing for them, they actually get their news out of Farmington, New Mexico. And so for me, it's about watersheds in Colorado. They've got to cross 1, 2, 3 passes to get to Denver to get care that they can't get close to them. So they're going down to New Mexico. So they're just going to figure it out based on where the providers are and where they can get access to service. So I mean, this whole, are we going to have 50? I don't know that we don't already have that. I think the issue for me, though, is there was a national goal of expanding access in the Affordable Care Act. The question for me now is, what's the next national goal? Is there one? Or are we just going to say, you know, now it's you guys figure it out? Is it going to be about cost? Because that's going to be a whole different issue that I think exchanges and this whole conversation has moved us to actually begin to think about the transparency now that's in there, and how do you just kind of try to manage that cost? Because my good friend to my right now gets blamed as the big bad insurance company, but a lot of what they have to do is just reflect the costs that they're seeing in what the provider networks are charging, and so they have to negotiate those kinds of things. And so I think we just have to really begin to think about what are we going to challenge ourselves to actually deal with.
If I